I can't tell you how excited I am to finally have this course up and running, and I really appreciate everybody who is taking the time to tune in for this. This class is meant as an introduction and exploration into how racism affects our patients' health, about our subconscious biases and inadvertent racist behaviors, and what we can do to improve our patient care. This event is a collaborative hosting of both the Obstetrical Acupuncture Association and Healthy Seminars. If you guys have questions during this webinar, please write them in the comment box at the bottom of the screen or wherever it says chat. And we'll capture the questions and ask them at the end of the lecture if time permits. We won't be able to potentially get to everything, but feel free to ask them. And a reminder for everyone to please keep all comments respectful. I want to really acknowledge how lucky we are to have our speaker, Dr. Farah Shroff, here today. Dr. Shroff is a public health researcher and educator who has worked towards better health for all for many years. She teaches at the University of British Columbia's Faculty of Medicine and is a founder and lead of Maternal and Infant Health Canada, which is a global public health collaborative that strives to improve the lives and health of women and children through education, research, and innovation. MyCan's anti-racism work involves the support of integrative health practices, traditional medicines, and other mind-body practices that emanate from the Global South and Indigenous communities. Dr. Farah Shroff has also amazingly just been awarded the Takami Fellowship with Harvard University's School of Public Health. So we are so lucky to be able to have her as our speaker today. Before I pass it on to her, I would like to start with an important acknowledgement that the hosting members, most of us, Sandro excluded, are situated on the traditional, ancestral, and unceded territories of the Coast Salish people. And we offer our deepest gratitude for the privilege to live, work, and play here. If you don't live in kind of Vancouver, Fraser Health, Coast Salish territory, I suggest having a look and seeing where you live, and if you are also on the unceded territories of Indigenous communities. So without further ado, I am going to pass us on to Dr. Farah Shroff. Thank you.
Thank you, Emily, and thank you, Sandro and Lorianne and everybody who's putting on this webinar. It is absolutely my pleasure to be here to see all your faces, those of you who I can see. It's always lovely to see faces. And so we are going to have a couple of hours together to explore a topic which I know doesn't sound like a fun topic. So we're going to try to make it, at least accessible and something that you feel at the end of this webinar. What I would really love is if you feel like both your head and your heart have been touched and makes you want to take action in your own practice. That's my hope for how we move through this. So as you know, the title is Anti-Racism 101 for Healthcare Professionals, Celebrating Diversity as we move towards health for all. Emily has already done a beautiful acknowledgement of the fact that wherever we are on some Indigenous land. And in North America, it's quite easy to find out which nation's land we're on. And I just wanted to ask if you could use your Zoom hands and just tell me who is here today. I'm guessing that you're all TCM practitioners. So I guess I know that about you already. Is that right? Yeah, all of you are, right? TCM doctors or practitioners at some level. Yeah, okay, great. I see a lot of hands raised for that. So you're all TCM doctors. And those of you who identify as women, can you raise your hands? Yes, right. I thought we had an almost entirely female crew when I looked at everybody. Okay, so that's great. All right, we will go through different aspects of who we are as we move through the presentation. So welcome all of you. I want to just tell you how much respect I have for your profession. My research areas are twofold. One is looking at social justice issues in health, and the other is looking at the mind-body connection and holistic practices. And I do have a paper coming up looking at TCM that'll be published one of these days soon. So I have a great deal of respect for your profession and have been a patient of some incredible TCM physicians. And talking about incredible TCM physicians, I wanted to pay tribute to one of your amazing colleagues, Emily Solomons. I'd like to, oh dear, I'm getting teary here. I'd like to dedicate this to her. If you look on her website, you'll see what she says. All are welcome. Dr. Emily provides BIPOC and LGBTQ2+ SI friendly and respectful care. And there she is walking the talk. After this 2 hours with me, I so recommend that you seek out any leadership from your own colleagues. She really does know how to do this work really well. And our agenda today, so we've done a little bit of an introduction. At least I got to know a little bit about who you are. You know a little bit about the topic. We've done a land acknowledgement and a tribute. We're going to do a little centering exercise. And then the flesh of what we're going to talk about is, why is racism bad for mental and physical health? How can we provide healthcare services that embrace ethno-cultural diversity? And 3 things that you can do now in your practice as TCM physicians. We'll do a visualization of a more equitable health system. And if we have time, we'll do a small group exercise with some case studies. And at the end, I've got some resources for you, some videos and some handouts, and you will get those from Healthy Seminars. So today is a pretty important day, as we can all imagine, to be talking about anti-racism, because just yesterday, many thousands of people were holding their breath for a verdict. As we all know, it's just all over the news that the verdict of the police officer who killed Floyd George was coming out. And it did come out as guilty, 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 which for many of us was a step in the right direction. And it really does build on the work of MLK, Dr. Martin Luther King Jr., who said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. It builds on the work of many, many people all over the world, here in Canada, absolutely, and in many other countries. We know that racism is a pandemic, just like coronavirus is. We know that it's a public health crisis as well. And I want to lead us into this little moment where we're going to take a little pause with some poetry. My own heritage is Persian, and I could live on a diet of Persian poetry. I love Sa'di, whose poetry we're going to be looking at right now, Rumi, Khayyam. I love them all. Furukhsad, the modern contemporary Persian poets. I love Persian poetry, and it always has something to say for good health. So Sa'di of Shirazi said, "Human beings are members of a whole, in creation of one essence and soul. If one member is afflicted with pain, other members uneasy will remain. If you have no sympathy for human pain, the name of human you cannot retain." And this is a poem that is used really often in the human rights movement to just talk about the human family and how an injury to one member of our human family is really an injury to all members of the human family. And apropos to our workshop today, another thing that the late great Sa'di said, "In the sea, there are countless treasures, but if you desire safety, it is on the shore." So let us go out to sea together, my friends. I invite you just to take a moment. It's the end of a day for many of us. And